Salam everyone. You're watching the uMentor Teenage Talk Show. I'm your host, Imran Daramsi. Before we start, we have a few messages that we wanted to share from Umoja. First, we wanted to highlight a new initiative by Umoja Outreach Foundation called Charity at Home. It's a way that you can support local families affected by COVID-19 just by buying gift cards to your favorite stores. Some proceeds from each gift card purchase will be donated to this financial aid program. To participate, visit flipgive.com or download the Flipgive app, join the Umoja team, start shopping, and help someone in need. Thank you for joining us today. On today's show, we'll be talking with Iman Saab, an aspiring registered nurse with a strong passion for clinical science and healthcare, to learn more about her experiences pursuing nursing in her first 2 years at Ryerson University. If you have any questions for our panelists, please use the live chat feature in YouTube Live, and towards the end, we'll highlight some of the best questions and our panelists can answer them. And as a reminder, we'll be switching to YouTube Live for all future shows. So every Saturday at 3 p.m., YouTube Live. Assalamu alaikum, Iman. Thanks so much for joining us today.
Wa alaikum assalam. Thank you for having me.
Yeah, you're welcome. So walk our viewers through the process of becoming a registered nurse. So what's the path that you're taking, and what are the other available paths?
Sure. So basically in Canada, the path that I've taken at least, well, I've started with a bachelor's of science. So usually you'd have to have your high school diploma. And then what you do is apply to a bachelor's of science in nursing. And this is a 4-year program. And throughout this program, you have the theory-based learning and the in-person learning where you get that clinical hands-on experience. And as you go through these 4 years, you're actually taught the skills that nurses use in real time, in the hospitals.
Mm-hmm.
And you practice these skills with patients at clinical. And as you go through the 4 years, you advance. So more is expected of you as you're starting to hit graduation. And by the time you finish 4th year, you would sign up to write the licensing exam, which is called the NCLEX exam.
Mm-hmm.
And after you hopefully successfully complete the NCLEX exam, what happens is that you're officially like a licensed registered nurse in Ontario. There's definitely other paths. I've spoken with other nursing students, some who have started in the college program, which is an RPN, usually registered practical nurse. And what they do is the 2 or 3-year RPN program, and then they bridge into, or they transition into the RN program. And sometimes it actually shortens the, sorry, not shorten. Sometimes it's actually better that way because some people like to have more time to practice and prepare themselves. So I would definitely recommend that for someone who's a bit intimidated to start on the university level, to go first into the college-based one and then into the university-based nursing program. But that's not that it's not challenging, because they're all definitely very tricky programs.
Mm-hmm.
But there's definitely lots of pathways, although I think those are the 2 most common ones.
Okay. So as a nursing student, what does your clinical experience consist of, and how are you treated during your clinical experience?
That's a good question. So the clinical experience, it kind of upgrades in a way with the years. So first year is actually based on long-term care homes, something that's big right now, that's being discussed a lot. So we learn dementia skills, how to deal with patients who have dementia, Alzheimer's, those kinds of issues. And also the more simple things like taking blood pressure, using a stethoscope to sort of listen to the heart sounds, listen to lung sounds, doing a physical examination. And actually I said that was simple. That was a very tricky thing to learn. Blood pressure is not an easy skill, but some catch on really quickly.
Mm-hmm.
And there's definitely other skills, such as assessing the eyes, the ears, we go into all those little sort of details, even the smallest dots on your skin. That's generally for first year. Second year, we get to the more advanced skills where you're giving injections, needles, you learn how to do the different types. We even learn how to hook up IVs and insert medications into those. We even learn wound care and how to keep an environment sterile while we're working on the patient. And what's really cool is that we actually got to apply these skills on patients. Like in second year, which I just finished from, at first I was on a cardiology unit. And so what happens is that we had a lot of patients with many complications, even things such as tracheostomies or trach tubes, where we would actually have to clean those because we've learned that skill in lab. Now, the good thing is that before we enter the clinical area, we're taught the skills in lab, and then we get a chance to practice them before we're tested on them. So our teacher, our professors, our instructors, they make sure that we're competent in these skills before we apply them on the patient. And if we do get nervous at clinical, we just go ahead and ask our instructors to walk us through the process. And a lot of the time they do. Third year is pretty much community based. So we learn new skills because you get to choose different sort of settings, palliative care, for patients who might be in the phases of dying. You learn how to care, how to provide comfort, so many different types, even in schools. So it's a really interesting year, third year, yeah. And fourth year as well. Fourth year is basically a compilation of everything where you go on and you put into practice all of the skills that you learned throughout the 4 years.
So it sounds like throughout this process, you have a lot of expectations placed on you. Like you were saying, you have to do every fine detail in the head to toe examination and all of that. So could you elaborate how you deal with all those expectations that are placed on you?
Yeah, it's definitely not an easy thing. It's like when you walk into your first day on the job and the employer expects you to be the best that you can be. They didn't hire you just for you to slack off. They want you to perform at your highest potential. And this is the kind of mentality that our instructors treat us with. And it was kind of intimidating at first, but for me, what helped me through it was just what helped me to make sure that I am keeping up with those standards and practicing accordingly was sort of reviewing the content. We're always taught in class that, listen, as student nurses, you guys are still accountable. You guys have responsibilities. You're caring for a patient. This is a life that's in your hands.
Right.
Now, don't forget that you have other professional licensed healthcare staff with you. So make use of those people. And I took that advice to heart. And whenever I would enter the clinical setting, I'd ask the doctors, the nurses, the speech pathologists, anyone who was around me that might know how to deal with a particular patient. I would ask them those questions. I would inquire. A lot of my capabilities came from just asking, listening, learning, and applying those skills. So it was really just a matter of making use of those who were available to me, and being conscious, of course. You're kind of forced to always reflect on what you do. So if I ever accidentally slip up in front of a patient or say something like, ew, that's probably the biggest mistake that you can make in front of a patient, is to say ew, because then they'll feel embarrassed. You're not supposed to. So you learn from those mistakes. Now I've tried my hardest, of course, and it's sort of become easier with the practice, with the years. By second semester, I was making sure that I was conscious of everything I do say, even the facial expressions, everything. So it's just a matter of practice and always reflecting, thinking back, oh, did I do this correctly? How can I improve? Sort of thing.
Yeah, that's really good advice. Don't feel scared to ask your superior for help if you need it.
For sure.
Yeah.
They're always ready to help.
So as for your patients, do they know that you're in training, and how do they react?
Yes. Okay. So they do actually know, because we have this line that we have to start with every time we walk in. For example, what I would use, let's say I'm still in second year, I would walk in and be like, good morning, Mr. or Mrs. So-and-so. My name is Iman Saab. I'm a second year nursing student, and I'm going to be helping you today. And some of them are like, oh, that's so sweet. You're a student. Yay. We're going to be pampered by you. Because we students tend to be very, very detailed with the care that we provide. Yes. Some of the nurses tend to take shortcuts, or they do things faster because they know how to be more efficient. But we like to do things as we're taught in the textbook a lot of the time. So some of them are very excited, whereas some of them get frightened sometimes. And we do respect that. We don't always, we can't put on all, we're still students. So if they do feel uncomfortable with us, we tell them no worries, still ring the call bell if you need to, let us know, and we'll we can help you out in whatever way makes you feel comfortable. But I've definitely had interactions with patients who didn't necessarily want me in the room. And I was a bit like hurt at first, but I was like, you know what, best to not take it personally, because it's just them and like how they feel, it's nothing directed towards the student themselves.
Yeah, exactly.
Yeah, it's just that we don't have all the expertise to be dealing with that, so they probably don't feel as confident. But majority have been really good experiences, thankfully.
Good. So what would you say would be your favorite experience so far working with a patient in clinical experience?
I think definitely my favorite experience had to be from first year. So in first year, I was working in the long-term care home, and we were working with patients who suffered from dementia, Alzheimer's, and I had never been exposed to someone with dementia or Alzheimer's or any of these things. And so hearing about it is one thing, but actually seeing it in practice is another, for sure. So I was kind of taken aback, when I first entered the unit. There was a lot of patients, most of them in wheelchairs. They require, most of them, full assistance with a lot of the things that they do throughout the day. So it was really interesting to just sit with a lot of them and see what their daily routine is like, and see their speech patterns and things like that. But one specific patient really stood out to me, because his case was really interesting. He was actually pretty young, like in his mid-50s, I would say. So I was kind of interested. I was like, let's see like what happened here. So I ran into his case and all of that. But when I actually sat with him was when it started to get more and more interesting, because this patient who suffered from dementia, he would speak to me with so much enthusiasm, and he seemed very like engaging in his conversation, and he knew what he was saying and everything. But I realized that he had repeated the same conversation about 5 times. And I kind of sat there. Yeah, I sat there in amazement, and I was kind of like, and I forgot to stop him. I wasn't gonna stop him. Yeah, I was like, you know what, continue. And so I tried to ask questions to see if I could change the conversation, but it would always come back to the same thing. And a lot of the things that he said, interestingly enough, were not real, but that's because he was a very, ambitious patient, and he had many, many dreams. But, he would speak to me of the lottery and this and that. Now, the most interesting about it was that whenever I would go up to this patient in the same day, he would have to ask me again who I am, because he'd forget. He'd be like, oh, hello, how are you? This and that. And I'd be like, hi, fine, thank you. So he would forget. After like half an hour, I'd come back, he wouldn't know who I was, and we'd start the same conversation again. Now, what was really interesting to me was that I thought, oh, you know what, like, I guess they really can't remember anything, this and that. Like, I started to put some certain like preconceived notions into play. Like, I started to consider that, oh, this patient, there's not much that can be done for him and this and that. But then when I had returned like 2 weeks later, and the patient recognized me and actually called me over, and told me, oh, Iman. And I was like, yeah, hi. And I was just so kind of like overwhelmed, because I didn't expect him to remember me. He was struggling to change one conversation. Like, he was repeating the same conversation 5 times the last week. And I was like, what happened now? Like, how did he remember me? So I realized that a lot of the time when you spend time with these patients and when you create activities for them, which is something that I had done for him, like when you spend time with them, when you give them a chance, there's definitely certain changes that you can make with them, certain improvements, developments. And that was something that I didn't think was possible, but my practice showed me otherwise. And it was like a really empowering moment that I was very happy to experience.
Yeah, that's interesting. So maybe this would be a good time to discuss, how does your passion for nursing tie into that, that story that you just talked about?
Sure. So personally, for me, I've always been a huge fan of science and helping people. So I was like, you know what? Let me see what kind of career options I have. Things that tie science and people together. Something where I can interact with people while applying that scientific knowledge that I've gained. And so I was sort of browsing for programs like with my family, and we were discussing things. At one point I was considering medicine, and then I was like, what about like nursing? I was like, oh, okay, let me look into that. And so I looked into the program and I realized that nursing caters to a lot of the things that I love and appreciate, things like helping others, things like my love for science, and just clinical practice and hands-on work. Although I do love the theory aspect of it, I like to be able to put what I'm doing into action. So
I'm sorry, could you talk about what you mean by hands-on work? Because I feel like there's this preconceived notion relating to nursing and the hands-on work that you're talking about in our community. So could you just speak to that?
no, definitely, that's really fair. Sorry, I'm just gonna fan myself. It's
Oh,
so
that's
hot today. But
yeah.
as we talk about these preconceived notions,
Mhm.
so that's definitely fair to say. Even in our
Mhm.
community,
Yeah.
even back home, I'm from a Middle Eastern community, so there are definitely those preconceived notions that, oh, nursing is a very, like maybe even below subpar. It's kind of
Yeah.
dirty work that you have to do. You're cleaning after the patient and this and that.
Mhm.
And these kind of scared me away from the profession at first. I was like, oh, I don't want to spend my time cleaning after people.
Right.
But I think that was like a wrong thing to think of, like a wrong thing to say, and B, it was kind of entitled of me to say that, because generally in these sort of communities, like we have a trend where it's like, oh, law, doctor, like lawyer, doctor,
Yeah.
accountant, big name professions. Those are the things that are more well respected.
Uh-huh.
You know what? I'm gonna challenge the norm. Let me go forth with this and see what happens. And when I actually entered nursing, I realized that I didn't really know what it was until I started to see it in practice and until I started to shadow nurses around me. And it was so nice because sure, there is a cleaning aspect. But when you think about it, you're not cleaning the patient for no reason. Like a lot of the time, these patients need your help. They're bedridden. They can't do it. No one would willingly want, well, not speaking speaking for the majority, like a lot of people would prefer to clean themselves. So when a patient is in that position, it's a very vulnerable position. So it's actually like an honor to be able to help someone who needs that sort of help.
Mhm.
They're putting their trust in you and you're helping them. And at the end of the day, everything we do is to prevent infection, is to make sure that the patient remains safe. um, it's to keep their skin intact. So even if it's little tasks like
Yeah.
rolling the patient onto their side every 2 hours, even if that's the stuff that the nurse does, there's a bigger purpose to it. And that's what I focused on, like the bigger purpose. Like, sure, there's going to be ups and downs of the
Mhm.
professions, the pros and cons. But honestly, like at the end of the day, I realized, wow, like the pros really outweigh the cons, because even if it does come with those like cleaning sort of duties, it comes with much bigger duties where you're helping provide comfort for this person. You're helping them heal. You're helping them ultimately improve, become better, and you're helping them like enter
Yeah.
the world again. So
Mhm.
I just felt that like everything I had known or heard about nursing sort of just withered away, because I was like, it's all meaningless, all that commentary. Because what I saw around me, what I saw the profession was, made me like fall in love with it more. And so I was like, you know what, I'm gonna go for it, no matter. And
Mhm.
now honestly, I've been seeing more and more people from my community like inquire about the profession, wanting to
Yeah.
enter it. So I believe that slowly there is starting to be like, there is a shift that's beginning, a
In
shift in
the
mentality,
nation. Yeah.
especially with our generation. Thank
Because I think that I think what you also were talking about with the story, with your favorite experience, is that um, nursing is more about holistic care. It's not just like, it might also include cleaning, but it's for a bigger purpose, and um, it's for something bigger, like as a whole. So I think
for
that's what you're getting at. Yeah. Um,
Exactly,
yeah.
exactly. It is something much bigger than what is presented. And uh, yeah, honestly, whatever profession it is, even if it might not be one of those things that people
Yeah.
talk about, like, oh, at the top, prestigious profession, I say give it a shot if it's what you're interested in.
Mhm.
Nursing struck my interest, and I was like, I'm gonna give it a shot. It doesn't really matter, because at the end of the day, it's a career that you're gonna work towards. People
Mhm.
won't be doing the job for you. You're gonna be working it. So if
Exactly.
you like it, go for it, for
Mhm.
sure.
Okay, yeah, that's good advice. Thank you.
Mhm.
So we have an audience question. Um, how have your family and friends helped with your progression through the nursing program? From Kazmi M.
That's a great question. Thank you, Cosme. Um, So my family and friends have been a big part of my success throughout this program, and I'm really thankful to have had them by my side, alhamdulillah. Uh, First of all, like the emotional support. Nursing is actually a lot harder than it seems. When I entered, I didn't expect it to be so heavy, but you start to learn so many different things, and it's all coming at you at once. And from someone who had just entered from high school, it was a lot to take on and a lot to handle. So a lot of times I felt, wow, like I'm not going to make it through. But then my family was there, my family and friends were there to support me and sort of tell me, no, okay, like keep going, you got this. Keep a positive mentality, remain optimistic, sort of thing. And a lot of the time they've actually helped me with like the assignments and stuff. Like when it came to blood pressure, I had to practice on someone so that I don't fail the test. So I would be like, Mama, Baba, please let me take your blood pressure. And they're like, Iman, we don't really trust you. I was like, please, please, please. I was like, just allow me to practice. It's just blood pressure. Don't worry. The time that really scared them was when I came home with needles. They're like, no, absolutely not. I was like, no, don't worry. I was like, this isn't even like medication. This is water. I wouldn't inject that into you. And they're like, okay, good. I was like, but can I have an orange, please? So we would get to practice I would practice around them and I'd show them and I'd actually demonstrate because at times we'd have to demonstrate in front of, sorry, I thought I heard something. Okay. We'd have to demonstrate in front of our instructors for 15 minutes and the instructor would remain.
That sounds so nerve-wracking.
Yes, it is nerve-wracking. We would have to demonstrate in front of them and they wouldn't say anything and they're grading us. And I was like, okay, then I need to practice before I do this. So what I would do is stand in front of my family. I'd be like, please, everyone, like, take a seat. And then I'd sit there with my needles and my entire kit ready. And I would just go ahead and walk through the steps and they'd be like, man, please, like, hurry up. Come on, we want to go sleep or this and that. So they've definitely helped me in a lot of aspects. And a big portion of it, as I said, was emotional support for sure. And aside from emotional, like I told you, like they actually helped with the assignment portions and all of that. Yeah, for sure. And friends also, I had friends in the program as well. And that was the most beneficial thing ever, because once you have friends in the program, you know what you're going through. Like you all are experiencing the same things. And so you work together to sort of, yeah, lift each other up, practice. Something I loved a lot about the nursing program was that it's like there is a competitive nature when it comes to grading, but not between the students. So we actually, yeah, it's actually really comfortable. Like it's a very positive environment where we're all supporting each other. So it was something really, really nice. Positive mentality. They were optimistic. Right. And they kept pushing and I kept the same thing in mind too. At one point I did reach a point where I was starting to be really pessimistic about it. And because we're told that like second year, for example, is something so hard. First year is something so hard. So in first year, I was like, wow, I don't think I can handle this. Like, will I even make it through the rest of the program? So it's really all about having like a positive mentality, trying to set up coping mechanisms if you can. Like if you get a bad grade, how are you going to cope with it? For example, I would sit, I would look at what I've done so far, all of my grades. I'd say, is there still an opportunity to grow, to improve, to do better? And I'd find a lot of the time that yes, there was. And even if someone does reach a point where that's it, like they're failing a specific course, it's not the end of the world. We all try, and a lot of the time we learn from our failures. So it's okay. Like it's definitely like don't give up on yourself. Don't put a lot of pressure on yourself. Because university, college, post-secondary school, in and of itself, can be already very stressful. So yeah, try to keep that positive mentality, even if it's just a tiny bit. It's good. It's very, very beneficial.
Thank you. Thanks for your advice. And it looks like we did get back on the air there. Sorry for all our viewers. We had some issues with YouTube that took us off for a few minutes. But I think they heard your final advice. So that's good. Yeah.
And if they didn't, it's just to stay positive and not give up on yourself.
Yep.
Post-secondary school can be intimidating, but even if you do face failure, do not give up. You've got this.
Great advice. So thank you, Sister Iman, again for joining us, for sharing your valuable advice. And best of luck Yep, you're welcome. Best of luck in your nursing career, inshallah.
Thank you so much. And best of luck to my fellow post-secondary students. Good luck in university, college, whatever you guys choose to do. Best of luck in all of it. And in your future endeavors too.
Well, thank you. I'm sure our audience is also very grateful for your great advice today. You were just watching the uMentor Talk Show. Tune in next week on Saturday at 3 p.m. on YouTube Live for our next episode, hosted by Sister Fatima Al Sayed. Thanks again for watching, and inshallah, we will see you next week.